So, Fran, what are, based on your research, trends in corporate banking in the United States?
So, based on clinical trials of cord blood that are going on right now, and looking at the trends of transplants of cord blood that are going on right now, my personal opinion is that cord blood is actually facing a bit of an inflection point, where the use of cord blood has been declining for a few years, but I personally believe is going to turn around and pick up. Now, you're going to ask why, so I'll tell you why. Traditionally, cord blood has primarily been used for transplants, and there is a list of 80 diseases where cord blood can be used, but most of them are rare, except for certain blood disorders like sickle cell and thalassemia, which are common in certain countries. But otherwise, it's primarily been transplants, and the usage of cord blood for transplants has been declining because a lot of oncologists and hematologists prefer to just use half matched bone marrow because it's cheaper and the patient recovers faster. The long term results may not be as good as cord blood, but that has been popular medically for a number of years. It's led to declining use of public units. Why do I think that will change? Well, two reasons, not just one, but two. One is that in regenerative medicine, we're seeing more use of cord blood to treat brain injuries, like, for example, cerebral palsy, where cord blood has been proven effective. And there are clinical trials running for stroke and other forms of brain injury. And I think that growing acceptance of these usages will lead to a growing need for the large units that are in public banks. For example, in cerebral palsy, it's 1 in 345 children. It is not a rare condition. So that is one reason I think there will be more usage. And the second reason is that clinical trials are using cells from cord blood for immunotherapy, special cells like NK cells, regulatory T cells. We're seeing trials of cord blood to treat autoimmune diseases. And in the United States, 1 in 15 people has an autoimmune disease. We're also seeing companies with products that use cord blood to treat arthritis of the knee, which affects about 8 million Americans. Severe arthritis. It's even more common if it's not severe. So these are all reasons why I expect more need to use cord blood, and particularly people who want an off-the-shelf therapy will be turning to public banks. I think there will be a resurgence of public banking, but it's a matter of time, but it will happen. That's my opinion.
So I agree with the comments that Fran made. And just to comment on cerebral palsy, I think the public cord blood banks are a really important source of units for infusion therapy for those children who often are too sick at birth to have their own cord blood stored. And in order to provide access to all children in need, the public banks will become more important if that indication is proven. I'd also like to point out that with newborn screening for albeit ultra rare diseases, but leukodystrophies and immune deficiencies, many of those conditions are treated with transplant, preferably with a cord blood donor early in life. And cord blood being readily available, quote unquote, off the shelf, and adequately dosed for young, small babies, I think will be used in an increasing amount as these diseases are identified in more and more newborns.